Hello guys, my name is Alma Marinas. I am going to be presenting the final program proposal for this course. Mental health is a critical issue affecting all populations, but cultural beliefs and societal barriers can create unique challenges for certain groups. The Latino community in the United States faces stigma due to cultural perceptions of mental health, where issues are often viewed as personal weakness or moral failing. This stigma, along with language barriers and a lack of culturally competent care, hinders access to treatment. This presentation explores the social demographic variables, cultural influences, and barriers to mental health care within the Latino community, with a focus on reducing stigma and improving access to culturally relevant mental health services. And this is a problem analysis. Mental health stigma within the Latino community is shaped by cultural beliefs such as familismo, which is the family loyalty, and respeto, which is respect, which discourage seeking professional help. Many view mental health issues as a private matter or sign of personal weakness, leading to isolation and untreated conditions. Additional barriers include language differences, lack of culturally competent care, and economic constraints. Fear of deportation and lack of insurance also prevents many from seeking care, particularly among the undocumented individuals. These cultural and systemic challenges hinder access to necessary mental health services and worsen mental health outcomes. And so for this program, the target population is the diverse Latino community in the United States, including individuals from Mexico, Puerto Rico, Cuba, Central America, and South America. This program will focus on various age groups: adolescents, young adults, middle-aged adults, and the elderly, with particular emphasis on marginalized groups such as undocumented immigrants, those with limited English proficiency, and low-income individuals. With over 60 million Latinos in the United States, this population is culturally diverse with values like familismo and respeto influencing attitudes towards mental health. These cultural beliefs often contribute to stigma, as mental health illnesses are viewed as a personal failing or family shame. This stigma prevents many from seeking help, leading to untreated conditions, social isolation, and worsened mental health outcomes. And this is the rationale. Targeted intervention is essential due to cultural stigma, language barriers, financial limitations, and lack of culturally competent care. Research shows that culturally tailored mental health services lead to better outcomes for Latinos. Integrating mental health into primary care settings where Latinos are more likely to seek help can reduce stigma and promote early intervention. Community-based approaches involving trusted figures like religious leaders or healthcare workers can further reduce stigma and encourage engagement in care. A complex approach, education, outreach, and improved access is needed to address cultural and systemic barriers and create a more supportive environment for mental health care. And so I created this logic model for destigmatizing mental health in the Latino community, where you start off with the inputs, which includes the funding, the staff, the partnerships, materials, and training. Move on to the activities: community workshops, support groups, cultural events, media campaigns, and school programs. Outputs includes the participation metrics, materials distributed, media reach, school engagement. Outcomes, which is the increased awareness, reduced stigma, improved access, enhanced communication. Impact, the long-term community change, the improved mental health outcomes, sustained support. And so the goal of this program is to reduce mental health stigma, increase awareness of mental health issues, and promote the use of culturally relevant mental health services within the Latino community. The outcome objectives include, on the short term, increase community awareness of mental health and early intervention through outreach and educational events, success measured by pre and post campaign service. We have the medium term, which is to reduce mental health stigma by 30% through cultural education, workshops, and media campaigns. Success will be measured by attitude surveys. And then 3, the long term, is to increase Latino access to mental health services by 25% through outreach, partnerships, and culturally competent care. The process objectives and activities. One is to develop culturally relevant educational materials, which is to create and distribute pamphlets, posters, and videos in Spanish reflecting cultural values. 2, conduct community workshops, partner with local organizations and trusted leaders to offer workshops on mental health recognition and stigma reduction. And then 3, to train mental health professionals to provide workshops on cultural competence, including family dynamics and traditional healing practices. And now I'm going to talk about the program design, which are the components. First, we have the clients, demographic information. You need age, gender, ethnicity, immigration status, primary language spoken to track the target population reach. Referral source, information on how clients enter the program, eligibility criteria such as belonging to the Latino community or experiencing mental health challenges. Then the staffing, staff roles, data on program managers, bilingual therapists and counselors, qualifications, certifications, bilingual proficiency, and cultural competency training to ensure staff are qualified. And then the workload, number of clients served per staff members to assess program capacity and efficiency. Material resources, we have the program materials, availability and distribution of culturally relevant educational materials. Translation services is very important, availability of translated materials to ensure the accessibility for non-English speakers. Facilities, location, data on physical sites to assess accessibility and facility capacity. Equipment, technology, use of telehealth platforms for remote consultations, and other resources, availability for therapy tools and educational material to support program delivery. And so here's the client flowchart that I created. Process 1, client entry and referral. Clients can enter the program through self-referral, family referral, or by referral from a healthcare provider, community organization, or public health programs. After that, the initial intake assessment is going to be completed to gather the demographic information, including language preference, such as Spanish or indigenous languages, immigration status, and mental health history. This is going to ensure eligibility and help identify the initial needs. Process 2 is the needs assessment. You can establish specific, measurable, attainable, relevant, and time-bound goals for the marketing campaign. Whether it's increasing brand awareness, generating leads, or boosting sales, clear objectives will help stay focused and track progress. Process 3 is treatment plan and development. Clearly identify and understand a specific group of people or businesses that we want to reach with the marketing efforts. Consider the demographics, psychographics, and behavior patterns to create a comprehensive profile on the ideal customer. Process 4, service delivery. This is mental health education workshops. Clients participate in bilingual workshops that focus on mental health awareness, stigma reduction, and available resources. We also are going to have individual counseling, group therapy, and case management. Process number 5 is the monitoring and follow-up, which is very important. Regular follow-up appointments will be scheduled to monitor client progress towards treatment goals. During these appointments, clients are going to be reassessed and adjustments will be made accordingly. Case managers are going to conduct periodic check-ins to ensure that the clients continue to assess resources and that barriers to care are addressed. Process 6 is the client satisfaction and feedback. Clients are going to be asked to complete satisfaction surveys at regular intervals, providing feedback on their experiences, the quality of services, and the challenges they faced. And then process 7 is a termination and exit. Clients are going to be discharged from the program once treatment goals have been met or if they no longer wish to participate. A final assessment is going to be conducted to determine the progress made, including any mental health improvements or remaining needs. Formative evaluation provides real-time feedback during the early stages of the program. It's going to ensure activities are well coordinated, identify areas for improvement, and helps track the progress towards meeting the goals. And so I wrote down a few. I have key evaluation areas. We have the evaluation of effort, focus, assess how well the program activities are being executed, including participant engagement and event attendance. And then we have the univariate questions, which is demographic distribution of participants, percentage attending workshops or events. Bivariate questions, relationship between language preference and attendance, acculturation levels, and willingness to engage with the program. Evaluation of cost efficiency. We're going to focus on assessing the how effectively program resources are used. The univariate question, cost per participant for workshops, events, budget allocation for direct services versus administrative costs. Bivariate questions include the relationship between funding for language services and engagement, cost differences between urban and rural areas. The summative evaluation measures the overall effectiveness and impact of the program after implementation. And for this, I did the same thing. I have the evaluation of the outcome focus. We measure if the program reduced stigma, increased mental health awareness, and promoted mental health service utilization. The univariate questions, percentages of participants reporting reduced mental health stigma post-program, and 2, improvements in knowledge as assessed through the pre and post-test. The bivariate questions, relationship between program participation and changes in help-seeking behavior. 2, the correlation between family support and stigma reduction. The next one is evaluation of cost effectiveness. Focus is going to be to assess if the program's benefits are achieved at a reasonable cost. The univariate question, cost per participant, and 2, program costs relative to the increase in mental health care utilization in the community. The bivariate question, relationship between increased outreach effort, and 2, the correlation between perceived program effectiveness and funding allocated to community outreach. And so now I'm going to be talking about the tools that I will be using. The mental health stigma scale will be used to evaluate stigma reduction and improvements in mental health awareness within the Latino community. This tool will be complemented by pre and post program surveys and qualitative interviews to capture both quantitative and qualitative data. And this is the rationale for the selection. 1, reliability and validity, 2, cultural sensitivity, and 3, pre-post measurement. And these are additional tools that I will be using. The pre and post program surveys. These surveys will measure changes in mental health knowledge, attitudes towards seeking help, and experiences with mental health services. It's going to provide quantitative data on program impact related to awareness and behavior changes. And then also the qualitative interviews. A subset of participants will be interviewed to gather in-depth insight into their experiences. These interviews will explore barriers to help-seeking behaviors and factors influencing the stigma. Impacts program evaluation. This evaluation aims to assess the effectiveness of a program designed to reduce mental health stigma, increase awareness of mental health issues, and improve access to services in the Latino community. Given that cultural barriers such as traditional beliefs about mental health can hinder help-seeking behaviors, the program focuses on promoting open dialogue, shifting perceptions, and addressing these barriers. Types of program data to collect. 1, we have coverage data that we need to collect. This is going to track whether the program reaches the intended Latino audience. And 2, demographic data ensures accessibility to high-risk or hard-to-reach subgroups. 2 is the equity data. Examines if subgroups within the Latino community are adequately served. And 2, it focuses on reaching underrepresented or the vulnerable groups, such as immigrants or those with limited English proficiency. 3, process data. 1, it monitors program implementation, adherence to service standards, and task completion. And 2, it ensures the program follows its intended structure and operational guidelines. 4, effort data. One, it measures intermediate program outputs, workshops held, educational materials distributed, and participant attendance. And two, it tracks the quality of the outputs, such as the effectiveness of mental health education sessions. 5, cost efficiency data. Assesses the program's cost per service, evaluating efficiency and resource utilization. And 2, it helps identify areas for optimization. 6, results data. It measures changes in knowledge, stigma reduction, and increased help-seeking behavior. 2, pre- and post-program surveys will assess these outcomes. 7, cost effectiveness data. 1, examines cost per outcome. And 2, it helps determine whether the program's benefits justify its cost. And 8, impact data. 1, it assesses broader community changes, including long-term shifts in mental health care attitudes and utilization of services. And 2, provides a comprehensive view of the program's lasting impact on community health. And everything that I just explained is nicely put in this chart where you are able to see it. Impact program evaluation design. To assess the program's long-term effectiveness, a quasi-experimental design is most appropriate, specifically the non-equivalent comparison group design. And this is the explanation. Non-equivalent comparison group design. This design compares the program group with a similar control group that does not participate in the program. It allows for the measurement of changes in stigma and mental health behaviors before and after the program. And here is a chart that I created. Again, you can go through it. This design allows for estimating the program's impact on reducing stigma and improving help-seeking behavior while considering potential confounding factors like cultural influences and socioeconomic differences. And I'm going to get into budgeting. The program budget is structured to allocate resources effectively for reducing mental health stigma, increasing awareness, and improving access to services within the Latino community. Key budget categories include personnel costs, marketing and outreach, event costs, training, and administrative expenses. The first thing is the personnel costs, which are the salaries for staff and facilitators. The estimated personnel cost is $50,000 annually. Number 2, we have marketing and outreach. Effective marketing and outreach are vital to ensure the program visibility and engagement within the Latino community. This includes the creation of educational materials, advertisements, and digital campaigns. Targeted marketing is essential to address mental health stigma and promote available resources. And I have an estimated marketing and outreach cost of $15,000. Number 3, we have event costs. This is such as like a venue rental, transportation, supplies. So hosting community workshops and seminars is a core aspect of the program. Event costs include venue rentals, transportation for participants and facilitators, and necessary event supplies like refreshments, handouts, and presentation material. And I have this estimated event cost at $25,000. Number 4, training costs, and this is for mental health professionals. Training mental health professionals on cultural competency and stigma reduction is essential for ensuring effective engagement with the Latino community. This training covers culturally appropriate practices and mental health education, and I have the estimated training cost of $10,000. 5, we have administrative expenses such as office supplies and technology. Administrative costs cover day-to-day operations, including office supplies and technology needed for program management. These expenses ensure smooth operations, efficient communication, and proper data tracking. The estimated administrative expenses is at $8,000. In this chart, you are able to see the line item and the estimated cost. At the bottom, you can see the total, which is at $108,000. This budget ensures that resources are strategically allocated to maximize the program's impact, achieving the goal of reducing mental health stigma and improving awareness and access to services in the Latino community. By prioritizing personnel, outreach, and community engagement, the program will maximize its effectiveness and sustainability. And so we just talked about budgeting, but I can't budget if I don't have funding. And so to fund the stigma reduction program, we will explore multiple sources, including government grants, private foundations, corporate sponsorships, and community donations. Each offers unique benefits to support program success. And underneath where you see the chart, you can see 4 different examples and their benefits. I hope I was able to present this to you in a very practical way. I hope you're able to understand what I'm trying to do here. Mental health stigma remains a major barrier to care in the Latino community, shaped by cultural beliefs and structural challenges like fear of judgment, lack of cultural competency, and language barriers. This program aims to reduce stigma, increase mental health awareness, and improve access by offering culturally relevant education and fostering open dialogue. By addressing stigma, the program can empower individuals to seek help, improving mental health outcomes. It ensures that services are culturally sensitive, breaking down barriers and increasing engagement with mental health care. And I leave you with the implications policy. The program can inform policies promoting culturally competent care, such as bilingual services and mental health professional training. At the national level, it can push for more inclusive insurance coverage for Latino communities. Practice, mental health professionals will be better equipped to engage with Latino clients through culturally sensitive practices, improving therapeutic outcomes and treatment adherence. And future research, this initiative provides a foundation for future research on stigma reduction in other cultural communities, helping identify common strategies and the long-term impacts on mental health behaviors, outcomes, and societal integration. Thank you so much for your time. The remainder of the slides are the references that I used throughout this presentation. Thank you.